Second chapter is Role of Caregiving Work, Professional Ethics. I already explained the role of caregiving work in the previous lesson. The next section is Professional Ethics of Caregivers. Section 1. Professional Ethics of Caregivers. There are 4 topics. 1. Respect for privacy. 2. Confidentiality obligation. 3. Prohibition of physical restraint. 4. Prevention of abuse. 1. Respect for privacy. A caregiver needs to understand how the user feels. Nobody wants to be cared, especially bathing and excretion. We should put ourselves into users' shoes. For example, when the user exports their skin in bathing care, you put a towel over the user's body. And in the excretion care, put the towel over the knees, and after checking the safety, the caregiver leaves the user alone. 2. Confidentiality obligation. A caregiver needs to know the personal information about the user to give the proper care services, but the caregiver shouldn't disclose the information like age, address, clinical history to others. And without the consent from the user, don't post the user's information and pictures on SNS. The confidentiality obligation will be effective after you resign from the work. 3. Prohibition of physical restraint. A physical restraint is anything near or on the body which restricts movement. For example, bind with a string and put a side rail on the bed for the user not to move. Put the restraining band for the user not to stand. Lock on the door to confine the user. And give a lot of psychotropic drug. Physical restraints are prohibited in principle, but there is exception. If the conditions are impending, no other means, and temporary, we can't help doing physical restraint, but other cases we shouldn't do physical restraint. 4. Prevention of abuse. There are 5 types of abuse: physical abuse, mental abuse, sexual abuse, financial abuse, and neglect. In the nursing field, female users suffer physical abuse more than male users. And the meaning of neglect is to abandon the responsibility to give enough care to someone who needs to be cared, like child and the elderly. Okay, you are done with the first section in the chapter of Role of Caregiving Work, Professional Ethics, which is Professional Ethics of Caregivers. Congratulations! You can get one step closer to be a good caregiver. See you next lesson.